from yesterday, and there have been 12 deaths, and that is no change. At the Greater Niagara General site, there are 14 cases since the outbreak was declared, and that is no change from yesterday. The number of confirmed cases currently inpatients at the site are 12, no change from yesterday. The number of hospital-associated cases currently in hospital are 9, no change from yesterday. The number of community-acquired cases currently in hospital are 3, no change from yesterday, and there have been 4 deaths in total, no change. At the Welland site, the total number of cases since the outbreak declared are 14, no change from yesterday. The number of confirmed cases currently inpatients at the site are 7, that's down 1 from yesterday. The number of hospital-associated cases currently in the hospital are 6, down 1 from yesterday. The number of community-acquired cases currently in the hospital are 1, and that is no change from yesterday. The number of deaths have been 3, and that is no change. At our smaller sites, we have had 1 case at the Niagara-on-the-Lake site, which is hospital-associated, 3 cases at the Douglas Memorial site, 1 is hospital-associated, and 2 are community-acquired. At the Port Colborne site, there is 1 case, and this is a hospital-associated case. An overview: we appreciate the media's continued assistance in helping us to get the message out far and wide about the importance of good hand hygiene. The best way everyone can help is through good hand hygiene. We have implemented the most rigorous hand hygiene practices possible, and we expect everyone to adhere to these practices: staff, physicians, visitors, everyone. Infection prevention and control is everyone's responsibility. Everyone must clean their hands at every opportunity, especially when entering and leaving our facilities, before entering and leaving patient rooms, and before and after touching any surfaces or equipment in the patient rooms. Additionally, at the Niagara General site, there are motion-activated overhead messages that people hear when they walk in the main entrance and through other areas of the building to clean their hands. It can be heard in 18 locations throughout that hospital site and the Allied Health Building. We're planning to move it to the other sites in the near future. We also have security guards posted in various areas at the 3 large sites asking people to clean their hands and monitoring visiting hours. There are alcohol hand cleaning units everywhere at every site, and we have also introduced large kiosks at every site entrance. We would like to follow up on similar comments of safety made at a news briefing yesterday in Toronto by Dr. Vivek Goel. He's the CEO and President of Public Health Ontario. Hospitals are safe places. The public is not at risk, and anyone who needs medical attention at our sites should come for care. It is safe now and has always been safe to come to any of our hospital sites. C. difficile exists in hospitals and in the community everywhere, every day. It is an ongoing challenge across the healthcare sector. C. difficile is a bacteria that mostly affects people who are elderly and have serious underlying illnesses and who are taking antibiotics. When we have patients with C. difficile or any infectious disease in our hospital sites, precautions are always immediately put in place. This includes signage in public areas and on patient doors, isolation precautions, enhanced cleaning, and dedicated equipment. In addition to these regular precautions, we've taken a number of additional aggressive steps to control the outbreaks. This includes enhanced cleaning at all of our sites, in every patient room, in every patient care area, and all equipment. This enhanced cleaning began last Wednesday, took place throughout the weekend, and will continue over the next 2 to 3 weeks. As I mentioned earlier, we have implemented rigorous hand hygiene standards that we expect everyone to follow. We continue to seek advice and feedback from resources available to us, such as the Provincial Infection Control Resource Team, which visited at the end of June to review our response to the outbreaks and provide recommendations. We acted immediately on the team's verbal recommendations, and as soon as we receive the team's written report, we will be moving on those recommendations immediately. A field epidemiologist is meeting with our physicians, our infection prevention and control staff, our decision support staff, and our information communications staff across all of our sites. The field epidemiologist will focus mostly on data collection and monitoring tools for infectious diseases, assisting in determining trends and establishing criteria to declare our outbreaks over. She will also be working with us to develop other monitoring tools for future use. I'd like to talk briefly about probiotics. We've been asked about the use of probiotics by many people. We are seeking further advice from infectious disease specialists re high-dose probiotics. Probiotic yogurt is available to patients. However, it is known that it does not cure C. difficile. It may help to prevent the spread. That's the update for today.
Thank you, Dr. Matthews. So we'll move now to the